Now closer to home, a Boston hospital is taking precautions after accepting a patient who recently traveled from Liberia. The patient remains in isolation at the Beth Israel Deaconess Medical Center this morning as doctors continue to monitor for any sign of the virus. Eyewitness News reporter Brian Yacono continuing our in-depth coverage this morning live in studio.
Patrick, good morning. The latest word from Beth Israel Hospital after an evaluation is that this patient who was transported from that clinic in Braintree to the hospital is not considered at a high risk for Ebola. Complaints of a headache and muscle aches from a patient who arrived at the Harvard Vanguard Clinic in Braintree prompted a lockdown of the facility. Meanwhile, that patient was securely transported to Beth Israel to be cared for in isolation. The patient had recently traveled to Liberia.
We are pulling out protocols that we have prepared for, drilled for, that our staff are aware of.
That includes a barrier between the patient's room and the rest of the facility. Even the ventilation system is protected. There's also special protective gear for healthcare workers who are in contact with the patient. Now, this all comes at a time of increased sensitivity to any possible symptoms of the Ebola virus. Already 2 people with southern New England connections have been treated for the disease at a medical facility in Nebraska. But the risks are real and carry potentially deadly consequences. According to the World Health Organization, more than 4,000 people in West Africa have died from the disease. Twice as many have been infected. Back in Boston, all those protocols and training have hospital officials saying the situation is under control.
We feel comfortable that it is working in a way that protects our patients and our staff.
Now, that patient in Boston is being kept in isolation as a precaution right now while more tests are done. Again, hospital officials say as of their current analysis, the likelihood of this individual having the Ebola virus is extremely low. In the studio, Brian Yacono, Eyewitness News.